So can you talk to me a little bit about how Incident Command has been running so far?
Well, we started the process of incident command right away when we realized that the potential for an increase of patients was going to occur in the Columbus area. And that probably started back the end of February. It was like the 28th of February. We had our very first meeting. And we utilized that structure where we worked as a team and everyone had a role, and we collaborated our information together from the very start to make the right decisions. Planning and operations, making sure, one person I didn't think I mentioned earlier too was our logistics, our supply chain. That has been a huge issue throughout this, and maintaining the amount of supplies, protecting our supplies, and making sure there's just a continual flow of what we need has been a really big issue. And so that role was actually done by Zach Caban, very important role for it. So we've worked together from the very start. We've continued to meet. We have been meeting since end of February very regularly and making our decisions as a team, utilizing everybody's knowledge. Medical knowledge from our providers, Dr. Couples, Dr. Howarder, logistic knowledge, lots of good financial decisions were made, and then also making sure we were very innovative and changed our care for our patients. Basically, everybody had an idea, and we kind of thought we worked through it as a team, how to make it work here for our facility.
Can you tell me a little bit about some of the changes that have been made in the emergency department due to the COVID-19 pandemic?
You bet. We did change some of the processes of how patients arrived to the ER and came in. We wanted our patients that were under suspicion and those that were positive for COVID to come in through the back door. That eliminated them being in the lobby where we run a risk of someone else becoming ill. So we tried very hard to do that with any patient that we knew was sick. We also altered the airflow in our department, making it negative air, allowing it to be a safer environment for our patients, for our families, and for our staff, because we really, that's one of the number one resources we have here at the hospital is staff. We also designed an area that we could test patients and actually evaluate them in an outdoor setting. And that was done in the front of the hospital, and which really decreased the amount of flow in the hospital, but also made sure that those who had a need and needed to be assessed could be done in a very safe fashion. We also did most of our testing out there, and of course have advanced and taken over the Test Nebraska site for the Columbus Hospital. And we are doing it just north of the hospital in the garage by the Husker Hangar area.